My name is Kaylee Lochran. I'm the program manager for the New York Matters program, and I'm located up in Buffalo.
Good morning, everybody. I'm Lucy Connery. I serve as the Community Engagement Specialist as a part of the Matters team, and I'm also located here in Buffalo, New York.
Hi, everyone. I'm Shay, Program Coordinator for New York Matters, located in Buffalo, New York.
Hey, everybody. I'm Sarah Santos, and I'm the Regional Care Coordinator for the Hudson Valley.
Okay. So if you visit our website, you've probably seen this little graphic here before on the right-hand side, but it has all of the different components of the New York Matters program. Really, the biggest part and what we're going to walk through today is this electronic referral system that we've been able to build in conjunction with the New York State Department of Health to facilitate referrals for patients with opiate use disorder from a whole variety of different medication-assisted treatment programs. We'll also touch on a couple of the voucher programs as well that are embedded into the actual referral process. So we work with a whole variety of referral sites. The program started with referrals coming primarily from emergency departments. This is still where the bulk of our referrals come from, but we quickly realized that this referral process is so applicable to other areas as well. And we've started to partner with inpatient hospital units, some law enforcement and EMS agencies, telemedicine platforms, as well as correctional facilities. So they all utilize the exact same referral process to get their patients linked to outpatient MAT clinics. We have three primary goals during any patient encounter. So the first being an efficient evaluation, the second, access to medication, and we'll walk through our suggested protocol here in a couple of slides that really puts an emphasis on medication. And then lastly, the referral to treatment. This is really where the New York Matters platform is going to come into play. So here's our current footprint in New York State. Lucy, Shay, and myself, we're all located up in where the program started and really where our biggest network of hospitals, clinics, and other agencies are currently located. And then back in September of 2020, we started to expand across the state and have started to develop some networks in other regions of New York State. Also, over the past 2 months or so, we've been busy hiring and training and onboarding new regional care coordinators all across New York State. And their focus is really to build and develop the program in their own home region. So we're lucky to have Sarah on the call today. She is our Hudson Valley Regional Care Coordinator and is specifically in charge of growing the Matters program in Ulster County. We also have an interactive version of this map on our website, so definitely feel free to take a peek at that. This document here is our mission, vision, values document. Again, if you wanted to take a closer look, feel free to visit our website. Really what it comes down to is every clinic that participates in the New York Matters program is willing to accept any patient who's referred to them. So regardless of polysubstance use or insurance status or anything like that, every clinic that participates is willing to accept. We'll just quickly walk through our suggested protocol. Also, again, pretty much all of the resources here are located on our website, so feel free to take a closer look. This is really aimed at emergency departments, but essentially if a patient presents to the ER in acute withdrawal, we recommend that they get their first dose of buprenorphine in the emergency department. And then we recommend that all patients are given a 14-day prescription upon discharge to allow a little flexibility on the clinic side of things, and then also just decrease any sort of medication lapse. The next portion of the of the protocol is the referral process. I'll walk you through this in more depth in just a couple of slides here. We recommend that patients and family members are offered naloxone kits. And then the last portion of our protocol here is where our medication voucher program kicks in. Any patient that either has Medicaid or no insurance and indicates this on the referral form is immediately issued a medication voucher that can cover up to 14 days of buprenorphine. So that'll cover any formulation and it can be redeemed at any participating pharmacy. We participate with a whole bunch of independently owned pharmacies and then also Walgreens, Wegmans, and CVS locations in New York State, as well as some of the surrounding states that are able to accept our vouchers. Over to Shay, she's going to walk you through what the patient completes for their actual referral process.
Thanks, Kaylee. So the referral platform is housed on the New York State Health Commerce System, and it is located on our website. And the referral system can be accessed on any electronic device, and we do provide iPads to anyone that is interested. So this is the first page of the referral site, and in order to access it, there is a unique authentication code. And the purpose of this is so that patients aren't filling out their own referrals, and so that referrals take place in a healthcare setting. And I do want to note that you do not have to have HCS access in order to site. All you would need is the unique authentication code. So this is the first slide of the referral process, and basically here we're gathering some basic demographic information, and ideally the patient is filling out this part of the referral. And then the last two questions have to deal with our 2 voucher programs. So as Kaylee mentioned, if the patient states they have Medicaid or no insurance, they automatically qualify for an up to a 14-day prescription of buprenorphine. And then the last question here has to deal with Uber Health. So we provide patients round trip Uber Health rides to their first. So here we have some additional questions, gathering some basic medical history, and if they've ever had opioid treatment in the past. And then we also ask if they would like to be connected to a peer in recovery for support. If they select yes, then a peer will reach out to them, typically within 24 to 48 hours. And then lastly, here we do have built-in consent, so the patient would just check the box consenting to all the above information. So this last part of the referral process is to be completed by the healthcare professional. So if there's a prescribing provider, you would list the name of the provider or leave blank if there isn't one. And then depending on the referral setting, if it's an ED, an inpatient setting, primary care, some site-specific questions would. So here is where the patient would select their clinic appointment. So this is the map view, and the patient's home zip code is pulled from the referral and auto-populated into the search engine there. And these red icons are all the available clinics in the patient's area. And so once you hover over one of those icons, the patient will get to see the exact location of that clinic. And so here we also have other forms of MAT listed that are offered at the clinics. And then pretty soon we will also include other forms such as HIV and hepatitis C testing, mental health services, other substance use disorder treatment, and COVID vaccinations or testing. And so basically the purpose of this is so that the patient can make the most informed decision on when selecting a clinic for treatment. So here we have the same exact thing as the map view, but just in a list format. And you'll notice here that the patient is selecting their clinic date, not the exact time of the appointment. So the clinic will reach out to the patient typically within 24 to 48 hours to schedule that exact clinic appointment time. So once the referral is complete, a few things happen on the back end. And first, absolutely no phone calls are made at the site of the referral. And then secondly, although the referral process was explained in a few slides, it only takes roughly 3 to 5 minutes to complete. So a fax will be sent to the referral site and printed out. Fax and email will get sent over to the clinic. All of this information will be emailed to the patient if they listed an email. If they selected to have a peer reach out, some basic contact information will be sent over to the peer and they will reach out to the patient. And then also all the vouchers, Uber Health, the medication voucher, if eligible, will also print out at the site of referral. And then all of this information will then be texted to the patient as well. We have an example of what the bupe discharge instructions would look like. And then lastly, this is just an example of the medication voucher. So again, we partner with Walgreens, Wegmans, and CVS in New York State and some other partnering states. And then we also have some independently owned pharmacies that participate as well listed. And so that concludes our presentation, and we can now open it up for questions and discussion.
Great. So I'm thinking maybe before we go into questions, Sarah, do you want to give just kind of a brief update of where we are in Ulster and then also just the Hudson Valley?
Yeah, for sure. I'd love to. Yeah, so my office is based in Poughkeepsie. I kind of got started in Dutchess County, but I did have some meetings yesterday and actually later today in the Ulster County area. So yesterday I met with Gina Altabrando, Julian Mercado, Katie Berlin, and Jay Musella from Institute of Family Health. And later today, I have a meeting with Tanya Stokes from Ellenville Regional Hospital. And I'm also looking, I think Katie is going to put me into contact with somebody from Health Alliance Hospital in Kingston. So that I plan to kind of develop in the next 2 weeks, really. Over in Dutchess County, we have Vassar Hospital and Mid-Hudson Regional, Lexington, and then also the health hubs with my own organization, which is Hudson Valley Community Services. So yeah, that's pretty much where we're at, specifically in the Ulster County Dutchess area.
This is really wonderful. So I'm so glad you have so many connections. So we really wanted to, so we have Juliana here who actually works with the sheriff's office.
Great.
She is the lead of an opioid overdose response team, which is made up of herself and 2 peers. And they're doing a great deal of linkage, working with a really high-risk, vulnerable population. So, you know, when I first saw this presentation, I my first thought was we have these linkage programs, and how this and for example, Juliana's program, which she can speak to a little bit more about,
Right.
what that fit could look like, because this is pretty, you have such a comprehensive service offering. So I'll turn it to Juliana, but
Great.
Something that was important to us.
Thanks for sharing all this information with us. Oracle is the opioid response as county law enforcement, and basically what we do is to link, individuals struggling with substance use disorder into treatment programs, different services within and out of the community. Those services could be like detox rehab placements, housing, temporary housing as well, mental health services, behavioral health, could be as much as food, childcare, any service they need. We're just here to navigate care. So what happens is that sometimes, when we have when you have overdose, non-fatal overdose, we also respond. We do wellness check, we link them, we go into the family or the individual, we link them to services, self-help group, in and out of New York State. So that's what we basically do.
Amazing. Yeah, I definitely am thankful for the introduction, because clearly there's a lot of intersection with what Matters is seeking to do. So yeah, it seems like we could definitely collaborate and work together. Kaylee or anyone from the Buffalo team, would you like to talk about what it looks like working with like similar law enforcement groups, or kind of how, that relationship looks?
Yeah, absolutely. So really, as far as the law enforcement groups look, the referral process is really going to be exactly the same. I think it's just a little bit more unique in developing the workflow and kind of who is going to complete that referral with the patient. But we're happy, Juliana, to work with your team and figure out how that will fit best. But the actual referral itself will look exactly the same as it would in a hospital setting or other medical. So really exactly what Shay walked you guys through today, that can be replicated in the law enforcement agencies as well. So we'd be happy to really partner with any hospitals, clinics, law enforcement agencies, or kind of other referral sites in the area that may be interested in providing these referrals to the individuals they serve.
Thank you very much.
Any other questions that we might be able to answer about the program itself or the referral process?
Yes, I'm interested to know the referral process.
Yeah, sure. So we can definitely provide the slides after today's. Like, we also have a website or a video posted on our website walking through the actual referral process in real time. So, what it looks when you go from page to page. So we can definitely share that as well. The whole thing only takes about 3 to 5 minutes. You don't have to make any phone calls from the site of referral. And the patient typically has an appointment at the clinic of their choice within 24 to 48 hours of that referral.
I was listening to you earlier about some of the partnerships you have in Dutchess County. And, you mentioned Mid-Hudson Regional. And so Mid-Hudson Regional is operated by Westchester Medical Center, right? So
Right.
our Kingston Hospital,
Mhm.
our health alliances as well. So there might be some way to make a connection, depending on who your contacts were at Mid-Hudson,
Right.
there's a lot of overlap. So we are seeing, I think some of even the supervision structuring. So it might be an opportunity to connect with them as well to say, hey, what about Westchester Medical Center as well? And is this something that we could, expand over there, or we can help you get in contact with? But I think your contacts are people I would connect you with.
Probably.
But it's just another thought because
Right.
the more resources, the better, as long
Totally.
as we're all connected. So once we
Mhm.
get that network set, we would love to have you come back to our strategic action team meeting to talk about, the different sites that New York Matters is partnering with, and just to raise an awareness for other providers so that they know as well.
I would love that. Absolutely.
Thank you so much. We really appreciate this. We are recording it, and Jillian is going to send it out to all of the people in our coalition, all of our coalition members and providers. And so they're going to have an opportunity to also see this. So
Thank you, everybody, for your time today.
Yeah, it was really great to
Yes.
meet you all.
Nice to meet you. Really
Thank you. Yeah, look forward to working together.
absolutely.
Thank
Alrighty,
you.
take care, everybody.
Have a great
Thank
day.
you.
Thanks.